on first.
Here's a diagram of crochet on the middle page.
The centerfold.
All right.
Oh, wait.
Now, Christine, I think I told you I'd do it.
Oh,
Yes.
that's right.
David with the third one. I got to tell you something. We're all on this panel. Just some of them are sitting facing that way, and some are facing this way, but you're all going to get a chance to participate. Now let me tone down the expectations just a little bit. Back when, here we go, we got a microphone up front. Back when we envisioned this idea that, you need to do anything? Go right ahead.
You go into that microphone.
Okay, that's fine. Perfect. We saw this as being an interesting topic that is very seldom discussed, and it's an important one. And so, through Pat, we recruited Chris, who said, no, I don't want to do that.
Drafted.
And so I said, Pat, let me talk to her, please. Okay. I said, listen, do you understand? We're not expecting you to stand up there and be the expert on sex after transplant. What I'm hoping to do is put a panel together who can share thoughts on some subjects. Whatever they share about their own personal life, that's up to them to do, but we're not asking them to do that here. So our panel is not a panel of experts who are saying, well, here's how I do it at home, or here's my experience, unless they want to do that, which they're welcome to do, and maybe someone will, I don't know. And so I said one thing that I'd like to do is reach out to the patient community, recipient community really, but it was an open thing, and get some input. So we put together a survey, which many of you were notified about, and what we were looking for is recipients and partners to fill out a survey individually, anonymously, so we don't know who sent it in. And we sent that out to about 1,000 people through the various blogs, websites, news groups, our own mailing list of 700 or 800, etc. Honestly, I took a poll, my wife, myself, Sylvia, we said, how many do you think you're going to get responding? And I said, you know, I'm going to be surprised if we get 10. I think Sylvia, not knowing better, said 50. My wife said a dozen. And we put that out late on a Thursday night when I got through putting it together. And by the next morning, I was just curious. I got up early and checked. We had 37 responses between 10 o'clock at night and 8 o'clock the next morning. So people are checking their messages late at night or early in the morning. And they were willing to anonymously give us some feedback. Over the next couple of days, that survey was open from Thursday night through Monday. We were curious. And each day, I got to admit, I eagerly went to open up the tool and see how many responded. We hit 100, and I was disappointed because 12 of them really were blanks. But people got into it and said, not for me. They signed out, and evidently that left a blank one. I said, well, they're really not valid. So I went and deleted those. So we're back down to 88. By the end of the closing survey, we had 110 valid responses of people who voiced their concerns about the questions that you probably saw. Now, having said that, what we have not done, I don't know if we ever will, is done any real detailed analysis of that. But Chris on her own has taken some of it, and the real meat of it is a lot of textual comments that people made. And I mean, to some of the questions, we had, out of 110 people, we had as many as 75 comments. Fascinating thing, a lot of repetition, should be tailored down. Guess what? I ran out of time between Monday and now to do that. We do have that raw data here. My intention is to put it someplace where anybody who wants to look at it can look at it. Chris will share what she has seen from it, and we're just going to use that on a couple of questions as a basis for opening up discussion. Our panel will respond to it any way they see fit. You're invited to comment also, and with that, I'm going to turn it over to our reluctant volunteer. Once she heard all that, she said, yeah, I think I'd do that. And then, of course, she went in and did extra work. And by the time we're through, you already have distributed, lunch coming back, the ITNS brochure on this that she gathered for us. And so there's some facts. We're not going to use that, but Chris, it's yours.
Okay, thanks. You all feel a little better? About everything. And I've got a portable mic on so I can move around. But, so Pat passed out, I think, a brochure to everybody. And I think one of the things that prompted you guys, if I'm not mistaken, to call me is that ITNS actually developed that brochure. And
Exactly why.
ITNS stands for the International Transplant Nursing Society. So which we have been, there are multiple of us that are members and have been involved with for many years. And so we found, you know, there's definitely, to give you some background, there's definitely a gap in the literature. You know, if you were to do a search, you could find tons of stuff on sex and intimacy and sexuality, but then when you kind of whittle it down to the transplant population, yeah, there's really not much at all. So, there was a gap there, and it was a need that we identified as an organization, you know, that was needed. So we worked on this. Pat, I think, is actually on the back of the brochure. She was one of the developers. So that's for your reference. There are a couple of things that I pulled out of there. If we need them, I put them on slides, but that's really for your review and however you feel it appropriate to use it. If you do feel, you know, that it's needed, or just know that it's there. It's also, for those that are not here today, it's also available on the ITNS website. It's downloadable. So just because, you know, maybe members weren't able to come today or people weren't able to come today, it's still available to them. So it's itns.org is the website. And if you go under patient education, you'll find that with some other resources. Okay. So let me tell you just a little bit more about me. So I'm a transplant nurse, and a proud one. Not a physician, not a psychiatrist, I'm not a sex therapist, you know, I'm none of that stuff. And I'm clearly not here to judge a soul. So we want this to be low key, and we want you to feel comfortable to participate, you know, in back and forth discussion if you feel comfortable. And if you're not, that's okay. But if you feel like you want to, you know, ask a question, we will use the I know a friend who starter. So no one has to feel uncomfortable if, you know, it's something that's related to them. So let's talk a little bit about this. And these are just some objectives. So we're going to talk a little bit about just sexuality because, you know, sexual fulfillment is just not sex, right? It's just not the act. There's a lot that goes along with it. We're going to review some of the survey results, kind of the take-home, a couple of the takeaway messages that I picked up that I thought were very obvious through the survey. And then, you know, these last two objectives about how sexuality could be affected post-transplant and what can we do about it, we can address that however we want and however it flies. So when we talk about sexuality as a whole, and you know, I have a couple of pictures through here, and I just wanted to be clear that as we talk about this, and as we talk about sexuality and how, you know, this applies to our life, we're talking about everyone. So we're not just talking about, you know, man-woman relationships, we're talking about same-sex relationships, we're talking about relationships from those from different cultures, you know, so this will apply to everyone.
Chris, now just out of curiosity, like CORE, these are volunteer recipients who you've taken pictures of for the sake of the presentation. We won't reveal their names, right?
No, these were from Google.
Stay with me, Chris.
Those local Pittsburgh.
Yeah, right.
Yeah. My sister. No. Yeah, anonymous. Okay? So sexuality just in general, right? We're talking about the state or quality of just being sexual and a preoccupation with or an involvement in sexual matters, right? So when we think about sex, we can think about a couple of things. We can think about gender, right? Are you a boy? Are you a girl? We can think about that act, the sexual act of intercourse, nookie, whatever you want to call it, right? We having relations. I worked with a transplant coordinator here in Pittsburgh at one point, and that's what she always said. You know, relations. It's exactly how she did it. I'm like, what? She said, you know, relations. Okay. But, or it's kind of the bigger picture of, kind of the birds and the bees, which is much more general and involves a lot more than those first two items. So, it talks about desire, it talks about voluptuousness, lust, it talks about, how we feel about ourselves just as people, not to start with, and then moving that into a relationship. So, we mentioned relationship already. This is part of our everyday life, right? So, when I got up this morning, did I put on my boxers or did I put on my lacy underwear? And how do each of those make me feel for the day, right? And so, we dress in a way that makes us feel good. We act in a way that makes us feel good. And all of those things kind of funnel, into our sexuality and how we feel about ourselves. Man, woman, and partner, we talked about already. And, it fulfills our needs for closeness and touch, right? So it's all those things that could potentially lead up to relations, but, it doesn't have to include that. It gives us kind of a zest for life, right? So, so I'll say I have a friend. It's really my husband. And who is my friend too. But I will tease him, right? Because the next day I won't talk about frequency or any details or anything between us. But the next day, his fellas that he hangs out at work will notice a little extra bounce in his step, And so it gives us a little zest. It makes us happy. It releases stress and tension, so it's good for us. It impacts our self-esteem and our body image. And that comes back also, to value where we are in our cycle of life and what that means to us. And our relationships with others. So if we feel poorly or if we feel badly about our own sexuality, that is going to, we're going to share that with others just through our actions and the way we communicate and things like that. So, tension. So that sounds people. So, okay, so I'm not sure why that only says survey. Oh, my survey slides are missing.
You've taken certain ones out. That's
No, I have about 5 of them.
Yeah, well, you've taken certain ones out. I can give you the whole set, but.
Okay, I have mine. Okay, so let's do this verbally.
Yeah, I'm under a lot of tension right now.
Are you tense? Sorry. Let me walk over there.
You're not going to lead up to...
We had, by the way, a great time at our table last night, I must say. Okay, so from a survey result perspective, I just wanted to share, Jim kind of shared the overall, how many people we sent the survey out to, what kind of responses we got back, those kinds of things. So just to give you a little more kind of demographic, information, to tell you a little bit about who responded and what the situation is, and just to kind of lay the land for the answers that we received. About 80, when we talk about, recipient versus partner, about 80% of our respondents were recipients, organ recipients, and then the remaining 20% were partners. We had from a gender perspective, we had more women respond. Yeah, about half and half. About 60% women, 40% men that responded. The majority, age-wise, were generally probably about 60-70% were between kind of the ages of 40 and 70. Most of them the vast majority were in long-term relationships. Probably 80+% were in a relationship for greater than 10 years. And from the organ types, kidney was the most prevalent, followed by heart, followed by liver. And then pancreas and lung were much smaller. Like pancreas and lung were like 6% and 8%. But the heart was number 1, followed by, kidney was number 1, followed by heart, and then liver. So some of the takeaway messages that we got from the survey was, one question was, how important, on a scale of 1 to 10, in a sense, how important do you feel sexual intimacy or sexuality is prior to transplant? And then one question was after transplant. And it was, are you pulling it up maybe?
I'm pulling up my full one, which you can refer to. I'll try and parallel what you're saying. So keep
Okay.
doing what you're doing. Maybe I
So
can
keep
support
talking.
you.
Okay. The more I talk, the less you have to talk, right? And the vast majority, like 70, 80%, it was a very high percentage of respondents felt that sexual intimacy is important or very important. It's a little higher after than before. So any ideas about, and by all means, you guys are the best ones to answer this question, but why would you think that would be the case? Because we did get some responses, and they were a variety of responses, but why, just kind of thinking, why do you think that would be the
I
case?
think the trauma of a life or death crisis brings you closer, and either you get closer and we're in this together and we're going on this road, or somebody says, I didn't sign up for this, and toddles off in whatever form imaginable.
Okay. Anybody else have any ideas?
Chris, I'm sorry. What question are you asking right now?
It was how important
Okay, gotcha.
before transplant
There's
and
the
after.
gender, by the way, that she just
Oh, yeah.
referred
There
to.
you go.
Male versus female, 40% versus 60% female. Right? How long have you been in relationship with your
Yeah.
partners?
10 to 20 years. 20 years is huge, see? Like 52%, but then followed by 10 to 20, which I thought was great.
And when you get to see this, I'll put this in a PDF format, we'll put up on our website, exactly what you're seeing here, just the slides, and you can study this all you want, okay, in terms of trying to figure some things out. And especially all the comments are captured here, none have been deleted. She's gonna focus on whatever one she has, and here is the before.
Here's the before. So if we look at, kind of the, well, I said 1 to 5, but not important, to most important, very important is 43%. So if you combine it with, important, then you're looking at, 60, 70, over 70% of the respondents feel that it's important to some degree before transplant. And then there's an after. Here it is. Yeah, so it's a little bit more, I think, but, I think part of some of the comments, that was a good comment. Anybody else have any other comments about why, before versus after?
They're horny before, they're horny after.
And you know what? There were multiple comments that said, I have no issues. I don't know why you're asking this question. You know what I mean? Why you're doing this. Or, I had no issues, things are the same, once I recovered, things were the same as they were before, right? But there were also those that are having, issues. They are having problems, and things are not the same after transplant. But I think before, a lot of the comments had to do with the fact that end-stage organ failure, right? And so you're focused on you're living, and you're focused on trying to stay well, and you don't feel well, and you're tired, and you're sick, and you're in and out of the hospital, and those kinds of things. And so that has, I think, in a lot of the feedback that we got, kind of had a higher priority, right? And you were in a very fragile stage prior to transplant. And so that affects not only the candidate waiting, but also affects the partner, right? And then after transplant, it takes time to recover. So you're focused on recovery, and you're focused on getting better, and you're focused on increasing the stamina to do many things. And so, it may take a while. So I think in the brochure, it said, typically physicians will tell you 6 to 8 weeks after transplant to allow yourself, right, minimum, okay, to allow yourself time to recover. Now, depending on how sick you were before and what organ that you've received, you may very well still be in the hospital, right? In 6 to 8 weeks. So it's going to be a little different for everybody.
This is talking about after recovery, not immediately when you're in the hospital. This is
Right.
like 6 months later, okay, type answer. And the other thing I would share with you, we have not done any analysis with this. You're looking at raw data. If we have some time, sometime we'll sit down and try and figure out. The raw data will tell you across the line what a person says. So you can say, kidney patient, 6 years out, here's what their comments were, here's what the responses were to questions like this. It's there, we just haven't done it. If somebody would like to play with that research, take down a PDF document, and you won't be able to do it from this document. But let me know, and we'd love to have a researcher do some analysis, and we'll come back with a research analysis. Anyway, Chris?
No, that's okay. So the first theme is, it's an issue and it's important, whether it's before or after transplant. Okay, so that's the first theme. The second one actually had to do with education about the topic before and after transplant. So, you know, when you look at the information in the survey about that, I think it would be it was very obvious to me that we're not good as healthcare professionals. We stink at talking about it, bringing it up, right? Your physicians, your nurses, your social workers, you know, they're focused on labs, biopsies, admission, meds, adjustments, you know, those kinds of things. And I think this topic is very important on our list, right, as far as priorities go. But then if you're going to add a facet to that, it's not the most comfortable topic to bring up, and it's not something you talk about all the time, right?
I can remember.
How's your sex life, right?
I can remember, for example, asking the question, and the answer was, you're not to have stand-up sex for at least 6 months.
Yeah, what does that mean?
Interesting thought. And so 6 months later, on a visit with my wife next to me, she says, do you have any more questions? This is a young, recently divorced, beautiful redhead that we had a good relationship with, okay? And she said, do you have any other questions? I said, yes, 6 months are up. Can I have stand-up sex now? My wife yelled at me. She blushed the color of her hair and left the room. So I'm one of the no's here. It's interesting to compare the 85% that got no education versus whatever the percent was, 45% that thought it was an important topic before and after.
Right. And I think this was a before and after question too, if I'm not mistaken.
This is after transplant.
Right. And it's comparable, right? So even after you're recovering and you're feeling better and you're ready to go and ready to, start up again.
Even if they just had the ITNS booklet to hand out to a patient, they didn't have to get into dressing.
Right.
Would you like one of these? No, thanks. Yes, okay. You got to start for a conversation, or you got something to take home and talk about.
Yeah, so I think, the first theme is it exists and it's important. The second theme is we're not good at talking about it, right? And to back that up, there's not a lot of literature, right, to guide us to talk about it. So.
Want to go there yet or no?
No, not yet.
Okay.
So this was a point, if you would have saw my slides, I had a really great slide that said, let's chat, and it was to prompt you that this is the time to talk, right? But just wondering what panel or anybody else, kind of what your either experience or what you have encountered related to this, as far as importance, as far as education, as far as relationships with your healthcare team, those kinds of things. Talk to me about that.
I would say that one of the things that I felt just overwhelmed with so much information. So, to tell you the
Elizabeth,
truth.
pick up the mic.
Yes.
This is our back row.
I felt overwhelmed with all the information that was being thrown at me. The only
Before?
thing
After?
before definitely, but I think I had a liver transplant and I did have some issue with what's the brain?
Encephalopathy.
Yes, thank you. And so, I had trouble filling out the forms before they could even list me. So I don't remember any discussion. And I did ask my husband whether he remembered any discussion, and he didn't remember anything. And by the way, I was transplanted here in Pittsburgh, so maybe they should do something about that.
About 20 years
20 years ago, yeah.
Maybe things have changed.
Yeah, and hopefully they have. But post Post-transplant, the only thing I remember, and my comment is right up there, number 1 up there, I believe one of my social workers told me that at some point that we could resume sexual relations when I felt up to it, but we were told not to get pregnant for at least a year. What was the other question you wanted to know? You wanted to know whether,
How important it was.
Yeah. Well, I would say post-transplant, the most important thing to me was to become more healthy. We had 2 very young children, so that was part of that. To become healthy, to be able to resume taking care of my children, and to relieve my husband of all the pressure he'd been under for all that time when I was sick. So it wasn't that important, really, to be honest with me.
Relatively, right.
Relatively, it really wasn't. And knowing my husband, it probably wasn't as important to him as it was for me to get better, to get more healthy. Going from there, if you want me to go since then, I would say for him, he's probably been sexually frustrated for the last 20 years. Because, I'm going to put it all out there. I'm not going to talk about my friend because it never really became that important to me. I enjoy it. We have a lot of sexual intimacy as far as being close, and we've been married for 30 years this coming Wednesday. We're very close. We are a wonderful pair, but the sex part of it has not been that important to me.
But you still have intimacy.
We do have intimacy.
Yeah.
Oh, go ahead.
Hey, Jim.
Let me talk a little bit about that too. I had a heart transplant, and in '94 I was diagnosed with cardiomyopathy. So for 15 years, our sexual life was really nil prior to transplant. And I can remember right after transplant, things have changed. And I tell this in a lot of my talks because I get the questions all the time. It's like, how are you feeling and everything like that. And I said the first thing I always say is that you have to remember I had a heart transplant. And what's the heart do? It pumps blood everywhere to every organ that you have. And the question comes up, well, how is your sex life and everything like that? And I really don't elaborate on it too much, but I can remember right after transplant, it's like, wow, I came out and it's like, wow, this is really great. But one of the first things that you were talking about is that, did anybody talk to you about, before transplant or after transplant about sex, any coordinators or anything like that? No, they didn't. And the thing, the first visit to my post-transplant coordinator, she's going over all this stuff, and she says, "Do you have any questions?" I said, "Yeah." I says, "When can I have sex again?" And she says, "Oh, you got to wait 6 to 8 weeks." I says, "You got to be kidding me." And she says, then we're talking about something else, and then within a couple minutes she goes, "Well, maybe if you lay side by side." I said, "What are you talking about now?" And she said, "Well, I'm going back to the sex question." So that was my information that I've gotten from the coordinator. And again, 15 years without, or very little. After transplant, again, I have a similar problem, is that right now, I am probably more, I'm more active, but I have the same problem that she has, is that the intimacy with my wife is not there anymore because she has actually not any more desire. My heart was 21 when I got my heart. So I'm like a 20-year-old person. So I'm like I'm going back to college again. Come on, what am I supposed to do? And that's basically how I feel right now.
Well, that's kind of interesting. I would raise the question. I'd love to hear your presentation because I'm going to guarantee I've given a lot more presentation you have, and I've never been asked the question.
Well,
so something in your talk brings it out.
One of the things that really comes out from, in fact, let me talk about one. I went to a health fair, and we were talking to a bunch of people there, and this woman come up to me and she started talking, and she said, you had a heart transplant. I said, yeah. She said, we went through the whole thing and how you feel, blah, blah, blah. And then when I told her that I had a 21-year-old heart, she grabbed me by the arm. She said, you're going home with me for the weekend. And the woman was, she was in her 50s. And I'm like, geez, my God. I was like...
Somebody had their hand up over here.
I was just wondering, like, the caregiver, so, like,
Partner.
Careful how you word this.
She has a friend, John, she has this friend that says,
Wait, hey, what's up? Put it all out.
You're lowering your. There's a certain amount of tiredness that you get just because, I mean, I'm more tired now than I was before he had his transplant, mainly because he's not allowed to do a lot of stuff, like mow the lawn, take the trash out.
oh, wait a minute, he's claiming that?
It's true.
He's
No.
not allowed to mow the lawn. I can vouch for that. I'm a lung transplant
Garbage
coordinator.
out.
He's not allowed to take the trash out.
He's getting away with murder.
He's not allowed to garden. He can take the trash out. Yes, he can take
He's
the
not
trash
supposed
out.
to pick up dog food.
No, he can't do it. He can't pick up dog.
So it's like,
Breaks my heart.
I'm like, I come home, I'm like, sure, I'm worn out.
Oh, this couple's paying a price for this workshop.
I'm worn out before I even, think about it. But they, in our, hospital, they had a guide for transplant patients, and they actually had a sex chapter,
Good.
and that was pre-transplant, and then post-transplant, they didn't really talk to us pre, and then post, this was kind of cute, our nurse practitioner asked us about our sex life and whatnot, and we're talking a little bit to her about it.
She asks us that every month.
And then his doctor like came down the hall and opened the door, and he goes, and we're laughing.
Yeah.
She goes, "What are you laughing?" He says, "What are you laughing about?" And we're like, "Sex." He goes, "Oh, I better leave."
Ron?
Yeah, there's a couple of things. I had a discussion with a psychiatric social worker at UCLA 4 years ago about this, post-transplant
Intimacy.
sexual situation. And she felt, and I kind of agreed with her, that for a long time when you're ill, and one of the partners, be it the husband or the wife, their role changes from a partner to a caregiver, or mother looking after child, or child looking after mother. And it's a whole different feeling. And then once you have your transplant and you're back on your feet, you want them to change their roles back, and that's where some of the problem comes in. Secondly, the drugs we take after transplant, a lot of them just kill your sex life, okay? Especially for a man. And I think that's part of the problem. And third, Elizabeth Hardin feels the same way with you. 20 years, the intimacy is there, but my God, we've been married 42 years, okay? So, yeah,
And so some of it for me could be age as well as.
I think it's very common. People talk openly about it, yeah.
I think, I just want to make that point. A lot of this that we're focusing on as post-transplant relationships is something that people that don't have a transplant also have issues with, and over time, long-term relationship, things fade,
Yeah.
okay? And so it's not totally unique. Yes, it may be related to the medications.
Yeah.
Yes, there may be other factors, but it's often a part of a long-term relationship. And Steve?
One comment. Elizabeth, my wife, and I hit 30 years in January, so it's about the same as you. But what I recall is not having major issues with sex after either of my 2 transplants, but significant ones when I had rejection, septicemia, and a couple of others, only tangentially related to the transplant. And that was when I really noticed an effect.
Interesting. Rosie?
My husband and I have been together 22, a little more than 22 years now. And it's funny because it seems like even though my kidneys failed and I've had numerous health problems and issues he's dealt with me and actually saved my life from having a stroke 2 years ago. When he thinks that, I'm feeling, that I'm actually feeling normal, because I get tired a lot but when I'm feeling somewhat normal and I'm doing normal everyday things, he'll kind of look at me, and the next thing I know, he's chasing me through the house. And he's always like, well, it keeps you young and gets your heart moving.
Good for him.
That reminds me of that commercial, was it Cialis?
Yeah.
Anytime during the day.
I always love that. Now, it stays there for 6 hours or more. See your physician.
There's a commercial for a program now where the girl says, don't bother calling your doctor, he'll just refer you to me.
Jackie, did you have your hand up?
Yeah, Jack.
I think you're talking about like how there's other factors out there that affect normal relationships too. And one of the big ones is depression. And I know we talked about it yesterday, about depression being a major factor. It's a major factor in a lot of our medications as depression is a side effect. It's also and I was involved with research about this at Akron General when I was getting my psychology degree, but after you've had any kind of heart surgery or real, long type surgery, they cool your body down to slow everything down. And you get kind of a hypothermia effect, which leads to mild cognitive impairment afterwards. That was one of his risk factors on his slides when he was talking about depression, was mild cognitive impairment. And we know now that that's a risk factor after you've had a big surgery that leads to depression. And depression is a big factor in, your sexual libido. And, it's something that we kind of know about, we kind of talk about, we kind of don't talk about on the transplant, teams. But I mean, like we have one social worker for all of our heart transplants. I don't know how many hundreds there are, but Kay gets run all around the Cleveland Clinic. And there's a lot of research out there about the role of the mental health professional in the transplant process and how important it is. So I wonder, a lot of this is related to the transplant in some ways because of the mental health aspects.
Chris, getting back on track if we may.
Yeah, and do you have something else? Jim?
Yeah, I just wanted to mention something about that too. So everybody looks at me as that, I had a little bit of depression before transplant. After transplant, I have not had any depression at all. And again, it just might be my makeup, but like I was telling Jim before, is that when I came out of transplant, I had a second chance at life, and I looked at life differently. And nothing was going to stop me, and I was going to keep on moving and going in the right direction.
I would ditto, I would say the same. So despite my earlier comment about my, being lower, I don't think it had anything to do with depression. I was not depressed. I was so happy to have had the transplant.
Paul, just by way of introduction, what's your transplant situation overall? What did you get when?
I had a liver transplant October 5th, 2002.
Okay.
So my 10-year anniversary is coming up shortly.
Okay.
And I'm going out on a limb by speaking here. I didn't tell my wife who was sitting back there. I was sitting on this panel until the last minute.
We're so glad that she gave you permission to sit on this panel.
Well, Jim, she didn't.
I know that.
As I'm walking up, she said, "Don't say anything." I'm not on a limb.
Anyway, you have this friend.
I may not have sex for a very long time after that. There were a lot of interesting comments. I think, and also our 30-year anniversary was this year, May 14th. And I think age has a bit of it. Just going through the whole process pre and post-transplant is pretty grueling, mentally, spiritually, emotionally, in all facets besides physically. And I do recall, I think one of my coordinators told me after transplant that you can have sex when you feel physically ready, which I thought was good advice. Because you're so sore from everything. It takes a while, and different people heal differently. So she kind of left it up to us. You be your own judge, which I thought was good advice. As far as being active, we're active, but I think I could speak for most men. We're all frustrated men. We're never active enough. I'll end on that.
Chris, back to you.
Our phone available for TRIO questions. The most frequent call we got was, "Can I have sex after transplant?" So I turned all the men over to Tom. Fortunately, Cleveland TRIO has a wonderful kidney recipient called Marcia Burke, and she told me I could channel any calls that a woman had about sex to her.
Very nice.
Getting pregnant, having children. So I had a wonderful resource there, and everything worked out so good.
Great.
And by the way, that's a great way to handle it. Remember, TRIO does not give medical advice. This probably walks a very thin line. So having a referral place to send those to for medical advice within the medical community is the right way to handle it. But I'm sorry, when somebody asks a question, especially a question like this, you're going to engage in a conversation. Just be very careful. Maybe the best way at the end says, by the way, it's different for everybody. I don't know your situation or story. Mine's different than yours, and everybody else is different too. So talk to a professional to back up whatever we talk about.
Also in pregnancy, don't forget there's a transplant registry. It happens to be based in Philadelphia, but it's a national organization. And they talk with people, whether it's the husband or the wife who's the transplant recipient. They're both issues having to do with pregnancy. And the transplant registry keeps all kinds of statistics. It's based out of Jefferson Hospital in Philadelphia. You can Google U.S. Transplant Registry.
Come right up with it. Yep.
Pregnancy registry?
Yep.
Transplant.
Transplant.
Transplant registry.
Transplant pregnancy registry.
Pregnancy, transplant.
Put the two words together and you'll find it, okay? Great program, great advice. If you are post-transplant and having children, they will invite you to participate in their database, for example. But that's where people can get advice, good medical advice, based on experience, data they've collected and analyzed, etc. Chris, back to you.
And when you were mentioning about TRIO, and not giving advice per se, ITNS is the same way. So we've definitely developed the brochures that we have available, and you may have seen that on our table. In addition to the sexual health one, there is also a pregnancy after transplant brochure. But they're meant to supplement, and to supplement what your transplant team recommends. So they're not by any means to be followed solely. So.
You got to remember, your team knows your situation
Right.
before and after. Another medical professional on the other end of the phone doesn't have that background to work from. And so the answers may change. For example, can you have a child after transplant? You would give an answer of yes. But remember, somebody who's got has genetically acquired this disease over time, was born with it, right? The dangers of passing it on to a child would change that answer from a doctor's standpoint who knows that patient. Everybody up the line has had a heart problem. You're going to have a child, you're going to face the same problem because it's in your genes. It's a different answer than you and I might think of in casual conversation with a patient. Be very careful is my point.
Okay, I've got the correct name.
Oh, thank you.
It's National Transplantation Pregnancy Registry.
Thank you.
They didn't really give advice. They told them, this is my experience.
Just want to make sure people all realize what we do. Go ahead, Chris.
And some of the, responses, when you get a chance to go through the survey, they're pretty interesting. I mean, there were a few of the responses that actually embarrassed me as a healthcare professional. I'm like, who did they ask this question to, and where did they get their license, right? But, like one person, for example, asked their physician, and this was a transplant team physician, about when they could resume sexual activity, and they said, well, you can't, you're done. So I had to read it again. And then they were insightful enough, they talked to their primary care physician, and the comment in the survey was, they listened to me, and he helped me. So whether it was, discomfort, lack of knowledge, whatever the reason, right, on the physician perspective, whether it was perception, on the recipient's side. I mean, regardless, that's the message, right? That's the message that was received. So, so when you have time, it would be interesting to kind of read through there. And then from a healthcare side of things, we have a couple of besides me, a couple of nurses. Oh, there's Pat. You moved.
I'm moving around.
So Pat Falk, which probably all of you know by this time, she has done years of education, been a transplant provider and has done years of education. So, and she also was on the committee and on the group that developed the sexual health brochure. So, I'm going to ask you, if you would, to provide some impact into kind of, have things progressed, have things changed over time, kind of where things are. And you you've been at various centers, so you can speak not just from one center forever, but from various centers. And then, Suzanne, I may pick on you too, because you are a lung coordinator, but you've also worked with all organs in different centers. So, if you guys could just kind of, give some feedback about what you think about the education piece.
Suzanne,
and
do me a
how this
favor.
fits in.
Walk on up there so we capture you all together when you get around to saying anything. Thank you.
Well, my experience is primarily with abdominal transplant. And as you know, I've been doing this since start. We've made lots of progress in the field of transplant that we talked about yesterday with medications and surgical procedures. But I think this is one area that we haven't really made a lot of progress in talking to our patients about. There are lots of drugs out there, and we know that a lot of the male drugs, the Viagra, etc., doesn't really interfere with the transplant medications. It can have other medical issues, though. But the thing is, the transplant team, guess what? They don't feel any more comfortable talking about this topic than what maybe you feel in bringing the topic up. And when I do talk to my patients and do my classes, I bring it up because it's a dirty job, but somebody's got to do it. And I feel that I owe that to my patients to bring up the discussion. That doesn't mean we have to solve all the problems. It doesn't mean I have all the answers. It doesn't mean they necessarily need to bring up everything. But I want them to know that particularly the nurse coordinators are there to help them. I don't want people to feel embarrassed if they have a problem or a question. In fact, what I've found over the years is that most of my patients or their spouse is the one that would give me a call and say, can I talk to you about something? And then guess what? The coordinator kind of runs interference with the transplant surgeon. And the transplant surgeon is a transplant surgeon for a reason. They're not urologists, they're not gynecologists, they're not sex experts. Trust me, they don't have all the answers for this. But I think your coordinator is a good person to help you problem solve and to help run interference with this.
And if we don't know the answers or can't address it, we know where to go to find them for you or to hook you up with the right person to discuss. So I've had patients approach me in various modes too. So I've had questions asked of me, and I am one that for many years I'm not good at bringing it up either, but I've been approached in a clinic room, in a routine follow-up clinic appointment. I've been emailed, and then which very much caught me by surprise because although the electronic world is absolutely saturating our lives, I thought it's kind of a different topic to send by email when you're not sure if things are secure, stuff like that. So I ended up calling them back and addressing the issue. But then I've also gotten calls on call, at night. When I'm on call. And so this story I must share.
Yeah.
Yeah, you will be curious with the timing. I'm going to let you know about that. So I was on call. This was when I, not too long ago actually. And so most recently I came from the clinic and I was an intestinal transplant coordinator. So I was on call, and I get this call through the hospital operator. And I'm like, hello, this is Chris. Can I help you? And they're like, Chris? I said, yes, this is Chris. Is this Chris Shea? I said, yes, this is Chris Shea. Chris Shea. I said, yes. It was one of my patients. And so he said, Chris, I am so glad it's you that answered the telephone. And he was like very kind of, probably about 30-ish, early 30s, just kind of very, he was excited. He was like very amped up, you know, and stuff like that. I'm like, what's up? What's going on? And he said, I have this emergency. And I said, what is it? And he said, I just met this girl. So he was single, you know, divorced, single. I just met this girl, and there's an opportunity for me, like in the next 2 hours. I said, okay. And so I find myself getting like, okay. Like I'm getting excited for him. And he says, I have this possible opportunity in the next 2 hours, and I think it's really, really going to happen. And I don't know if it's okay, and I want to know if there's anything extra that I have to do. So I'm like, you're fine. I said, use protection and have fun. Goodbye. So we get off the phone. The next night, the pager goes off. And long story short, it was the same patient. But he said to me, he said, I know this is after hours, and I know I'm just supposed to call for emergencies, and this is not an emergency like it was last night. He said, but I just want you to know that everything went well. So you can tell, you know, you have a good relationship.
This is why we get paid the big bucks.
He said, I just want you to know that everything went well, and I did what you told me to do. And he said, I even, so you know, with intestinal transplantation, you know, it's absorption is an issue. I tend to get dehydrated very easily. And he said, I even stopped a few times to drink some water. Because I didn't want to get dehydrated. And I didn't want to like tuck her out before I was is fabulous. Exactly what I said. And I said, anything else that you need from me this evening? He said, no, but I just wanted to make sure that I told you, and this was when I could call, and I was hoping that you were on call again tonight. Yeah, so, you know, you just never know, right?
You never know.
Suzanne, how do you follow that one now?
You never know.
Yeah, good guy.
You never know.
And you can kind of, and I think that leads to, I mean, and it's something that I'm proud of, you know, the relationship that you develop with your healthcare team. And, you know, a lot of times you're developing special relationships and you're following the teams for a long period of time. You know, like we know what's going on in each other's lives. We see kids grow up. You see your nurses get pregnant, have kids. You know, we see graduations from high school. We see each other becoming grandparents, you know, stuff like that. So that's something that I've always been I've loved, you know, and I've always been very proud of, you know, that relationship. But that actually opened up, you know, a brand new kind of arm of support. Yeah. But go ahead.
It also shows that I tell people in relationships, just like in here, in the group that we're sharing, one of the most important things is to have a good sense of humor. Maintain your sense of humor. Whether it's with your partner, your significant other, or here as a group, you know, that's here to support each other.
Well, speaking of senses of humor, I had a very good relationship with one of my patients. He had been waiting for his heart transplant for 9 months, and during that time I was carrying my first child, and so he met my first child, he got his heart transplant, and then he was waiting to go home, and he had some issues after transplant with rejection, so he was with us for almost a year when I was working at the VA in Cleveland. And so it came to the point, and we're in my office, and we're having one of his post-transplant visits. It was not an official visit, but it was a little, let's do your medications, let's review everything, and so when can I have sex again, Suzanne? Well, you're at your post-transplant visit, you're past week 6, and you're healed, and you can have sex again. But no monkey sex. And he's like, what is monkey sex? And now this guy is crazy, so I'm like, you don't know what monkey sex is? And he's like, I'm like, no hanging from the chandeliers, no getting crazy, no, I mean, this guy was crazy and had multiple partners, and always, always, always wear a condom, because God knows you're gonna catch something. So you have to keep a sense of humor, because you get to know your patients and you know they're crazy.
Yes.
Yes, ma'am?
I can tell a funny story. My son was in college, and he was followed by his transplant, his hepatologist at the Cleveland Clinic when he was home, and when he was in college in St. Louis, they followed him, and they worked cooperatively. They communicated, which was awesome. But his coordinator called me, I don't know, it was sometime during freshman year or sophomore year, and said, I just wanted you to know, in case Brent asks you, and he was still followed by pediatrics until he was 22 because he was a college student, okay? But nevertheless, he was a college student, so Lynn said to me, I just wanted you to know I had the sex talks with him. I went, oh, okay. She goes, well, I didn't know if the docs did in Cleveland, and I know our docs are not good about that, but it's important to me to make sure we share that information. But I didn't know how open your relationship was with your son, and if he would tell you, and I don't know if you've had that talk, and I'm like, I haven't had it with him before he was sick, I'm going to start now. My husband might have, I'm sure he did. No, he didn't. But we laughed about it because I was more concerned after his transplant to talk more about, and he was as red as your sweater up there, because I'm like, honey, protection's important. We haven't, and so after his transplant, I talked to him. But when Lynn said, I just wanted you to know we had the sex talk, didn't know if he would talk to you about it, didn't know if he was going to laugh, cry. She said, but his expression was like his mouth was dropped because she brought it up. But she said, I have to with my teenage population students, and I start even at middle school age talking with these kids, and high school and college. But that's her, and I don't know if it's a focus of their center or if that's her, but I thought that was very interesting.
It's a very, very hard subject to bring up with your patients. And it's very easy when they bring it up and they say, we need Viagra, we need Cialis, we need this, and then you delve into it with them. But it's very hard to say, so how is your sex life in the middle of your conversation in there? So is your incision healed? Are you having any shortness of breath? Are you having any of this, that, or the other thing? But it's very hard to go, so how's it going down there? It's very hard to say that to them. But the other parts are very easy. They roll right off the tongue as far as the medical stuff, and that is medical as well. But it's just a different part of the medical. So it's not an easy subject. So you guys bring it up to your healthcare providers. It's much easier coming from you. It's uncomfortable for you, but it's very uncomfortable for us as well. But it's an equal relationship. It has to be.
How many of you has the doctor brought up the subject with you?
You want to go to the slide to see the answers from 100 people?
And how many of you has the nurse or social worker brought up the subject? Let's see, just in general. So there are a couple more than with the doctor with things. But yeah, I think it just proves that, we're not necessarily comfortable with it either.
When you have access to this set of slides at home, this is one of those questions where we didn't make it multiple choice. If I thought about it, maybe I should have, like she just asked. But instead, 21 people gave us comments answering the question, what was the source of any education about sexual intimacy after transplant? And so you can read the comments. Again, you're not going to have time to read it here. And we're going to got to give this about another 10 minutes. We're going to have to move on. But it's so important, I want to give it that additional time. So,
well, my kudos to Chris and Jim for getting this up here and doing this. And I think it shows that maybe it's a survey that we need to do in more depth and in more detail so that we can get some of these results and then go back and show them to say, hey, transplant doctors and nurses, you're not doing your job, you're not doing right by the patients because you're not bringing this up.
It's clearly a gap in literature, from...
we probably have enough from this survey with the analysis we could do to come up with something like that we could provide back to INS as a thank you for the brochure as an example that you then could take forward if you'd like to with what we could analyze together to educate or to provide that feedback to the community that is serving recipients and their partners. So we've got enough here to start with that, Pat.
Yeah. 2 years ago, in Cleveland, at Cleveland Trio, we had a seminar. It was our spring educational seminar. It was Sex, Drugs, and the Blues. And we had Drew Silverman from Tampa come and talk. And it was very well attended. It was our biggest attendance ever that I can recall at a conference, at an educational seminar on a Saturday morning at 8 o'clock in the morning. And I don't think it fulfilled everyone's needs. He talked a lot about general intimacy and things like that. They wanted this nitty-gritty, talking about more sex. And but I think that he fulfilled some of their needs, but I think that more of their needs need to be met, and I agree that this is a very hot topic to transplant patients and their significant others. So I agree that this should be moved forward.
All right, let me just add one other thing to both of this. And that is, first of all, here's a good role for TRIO to play. A voice of the transplant community gathering this kind of background information to provide for a professional organization to move forward with. But secondly, let me give again a pitch for the transplant presentation library that we offer out there. All right, we've got 40 different topics out there. None of them are on sex yet. This will be captured and put out there and be one. But my question, Suzanne, is this, okay? Don't worry, they won't know who you are. We won't tell them. Careful, you're on camera right now, Pat. And that one's not being, that's not going to get edited.
That's not my trio picture.
Keep protesting. It's getting cuter by the minute here. My point is this. Suzanne, Pat, Chris, anybody, if you are involved in a conference or a presentation that somebody's coming to give on a topic that you think would be of interest, first ask the person or whoever's organizing it to get the permission, would that person mind being recorded? And explain to them the recording is for use by TRIO National to spread the message that they're sharing to the entire country. Okay? I have yet to have anybody turn us down. We originally had a formal document to sign, and that scared them off. But if you just ask them, we're not requiring that signature anymore, and if they say yes, there is somebody nearby who's got one of these very inexpensive video cameras to record it. If it's absolutely impossible to find that, and I can't believe that, contact Sylvia, who will work with me to get a camera in your hands. You do not have to be a video expert to do what we're doing here. We put this basically on a tripod or on a table and turn it on. Get your speakers to stay in one spot and try and capture the screen in the background. That's all it takes.
Jim?
Yes?
Didn't TRIO send the camera to each chapter
No.
a year or so ago?
No, we sent a webcam to each chapter. Now you can pull it off with a webcam, but I don't think you're going to get a good enough even for our low-level quality, okay? But somebody there, every family these days has a video cam, and I'm telling you, we started this by using the video capabilities on an average camera, not a video cam. And they have movie capability today. Believe me, it's pretty damn good. So if you can come up with that, like the ladies here described, basically we would be glad to consider it for use in that, and you become one of the topics. And so,
Jim, can I?
Yes, go right ahead, Jim.
Suggestion? Since I'm up here on the panel now, can we allot more time next time we have a conference or something, that maybe go 3 hours and talk about this?
you know, Jim, you're absolutely right, and the problem we have is...
Sounds like a 21-year-old wants to go 3 hours.
Well, now I understand why it always comes up in his presentations, okay?
That is why I suggested him for the panel.
Yeah, good for you, Suzanne. I have to say that our goal when we put these on is to leave you hungry still. If we get past where you leave this and say, that was too long, we blew it. I would much rather you say, I wish we had more time on that subject, and leave you hungry, okay? And this is certainly a topic that could be a conference all by itself. And so to address everybody's interests, we have a variety of topics. Some of the presenters were absolutely fabulous, and you probably want to have more conversation, no matter how we schedule it, to try and provide more time for conversation and interaction it's never enough. We accept that. And so we're not doing the 5-day conferences that they used to do back in '91, and we're doing a 2-day education, and this is an important subject. We've got quite a bit of background here. You'll have more of that, and you ladies have done a fabulous job. Keep going. Let's give it 5 more if you need to.
I need to get back to the slide.
Go ahead. Oh, I'm sorry.
Thing.
Chris, if you need us, we're here for that.
Okay. So my survey slides weren't there, so let's see if the other ones are. But, the other piece too that I want to say is that you guys are like right on, with what is in the literature, you're right on. So I thought this was kind of fun too. Anonymous people again. So we talked about physical issues, the fatigue, just the overall fragility, of your medical conditions. And then there are, some physical things, some metabolic things that are going on that, oftentimes need to be addressed. And finding someone that will hear, listen, and help, I think is a challenge sometimes. I certainly don't want to dive the medical side of things. I'm kind of biased to the medical teams, but it's important. It's important. So self-esteem issues can play a part as well, with altered body image and the roles. We talked, was it
Rosie?
Ron that mentioned, I
Ron,
think, the
yeah.
switching of roles and things like that throughout the transplant process. And just, loss of intimacy, sometimes just by default of everything that's going on. And, we're thinking too, it's just not this stuff and it's just not physical, but think about, there's emotional things, you're worried about getting your meds, there may be financial difficulties, insurance coverage, just your normal everyday life still goes on, right, in the midst of the transplant process. Depression and fear we touched on, and then lack of interest. And these are in categories, by categories, not drugs specifically, of course, but in categories of which can potentially affect libido and affect desire and affect your energy levels and those kinds of things. So the the blood pressure meds, the antidepressants, any anti-seizure type medication, the lipid-lowering agents, nicotine, alcohol, and marijuana. And every time I see marijuana, I always think of the surgeon that I've worked with. He's from Italy, and he says, marijuana, is how he says it. And for the first month, I was like, what are you saying? Marijuana. I said, okay. So alcohol and marijuana. Oh, there's the Let's Chat slide. Do you like it?
Yes.
Okay. But we chatted already, so that's good. So just some very general tips. This is so individualized among people, individuals, as well as among couples, that there are no set rules. There's no book that you are going to buy that's going to tell you X, Y, and Z. It's like being a parent, right? There's no book out there that you can buy that tells you how to be a parent. But if you kind of keep these things in mind, and you can think about how you can accomplish kind of these tips in your own life and in your own relationship. And communication is a huge key. However you accomplish that between you and your partner, it's huge in order to be able to relate back and forth what you like, what you don't like, what your fears are, to be able to move forward. Having a sense of humor, I don't think any of us are lacking in that, as evidenced by today. And then just tolerance, because we know things don't always happen when we want them to. So sometimes, patients can be kind of tested, but it could be well worth it. And just to enjoy one another. Again, it's the closeness, it's walking holding hands, it's watching television holding hands. It's just that closeness and that touch, and those very simple things. And then just having realistic expectations for each other and yourself. So we talked about the healthcare providers as a potential resource. Support groups like this are actually great, and many times there are support groups based in your own local, transplant center or hospital. And I was at the Transplant Social Work Conference, the National Transplant Social Workers Conference, a couple of weeks back. It was in San Francisco, and there was a social worker that talked on this issue there. And she said whenever attendance starts to lag off a little bit in her support group meetings, she raises this topic, and it just rejuvenates everything. She says the attendance spikes high up, and interest kind of comes back, and networking comes back, and all those kinds of things. So so that's definitely a resource. Professional organizations, TRIO, ITNS, and then the literature is limited, but it's still there. So this is the sexual health brochure, which you probably recognize because you each got one of those. But I wanted to, and again, it's on the website, it's downloadable, and this is what the pregnancy one looks like. And I think that was really it, as far as wrapping up, in case anyone had, any more comments or questions, or, this was definitely, it wasn't a ton of time, but we wanted to use this time to kind of break open this topic and this discussion and kind of see where we could go with it in the future,
So a topic that we had scheduled for half an hour, we've just given it an hour, and we haven't even touched the surface for some people. So all of these will be up on our website for you to see. And what a great topic to bring into your local meetings, to bring those members of interest in. Find a local resource that we'll talk to. Your social workers either can be the speaker, or they know a resource that would come in. And again, we got ourselves a panel together to try and bridge into the openness that you had. And it really worked very well. We didn't put them too much on the spot, and you openly shared. And it worked out great. And of course, Chris went beyond her promise to facilitate because she didn't want to present, and did an excellent job presenting, Chris. So stay right there just for 1 second. Chris, on our behalf of TRIO, great quotes and great leaders.
Oh, great.
And
Thank
don't
you.
forget there's a DVD in back that you'll enjoy on your computer.
Thank
Okay?
you very much.
Thank you. Great job.
Thanks.
Great job. Did you get it, Susan?
Yeah.
Okay. No, she was taking pictures, and she's always critiquing me for not getting the right position, whatever. Our panel, we thank you very much for your bravery, as well as your contribution. Okay, where we are on the agenda is coming into, right on, a little bit later than planned, the TRIO looking back 25 years and moving forward. I'm sorry, hold on. Okay, it's still on. And that's really meant to use what we did last night, and like I say, in lieu of what we had last night, I've been asked not to take time today to show that. It is up on YouTube. You can link to it from the TRIO website. Very simply go to the home page, and where right now this advertisement, the logo is for this summit, there is a comment there that tells you click here to see what you saw last night, but you'll be able to hear the sound 1,000% better. Okay? By all means, feel free to share that. So that's the history part of it. I think we've heard from several people some of the background of TRIO. And that would be a great, another hour of history gathering. And in lieu of that, what you have is those pages with the TRIO chapters, founding date and story. So that's the back side of it. What I'd like to do right now is just walk through the new strategic plan that TRIO's board passed yesterday morning right here in Pittsburgh. So just stepping through quickly to let you see what this is all about. This will be the subject of communication to your chapters. And we'll have it up on the website too, so every individual member can see it too, if they're interested. So walking through it quickly, here we go. Our overall mission did not change. It's still a nonprofit international organization committed to improving the quality of lives touched by the miracle of transplantation through support, advocacy, education, and awareness. What does that mean? Look at the vision, and it is explained on our website under About. And so I'm not going to read that all to you, but it just explains what each one of the terms mean. So everything in the strategic plan is in support of course, our mission and our vision. And so the overall framework of the strategic plan is focused around a simple four-goal structure. And we had one of our members at large, Will Oler, act as a facilitator for us in putting this together. And he did this for industry, so he was a professional at it. He volunteered his services. He flew up to Philadelphia. We had an in-place meeting for an evening. And then we went back to phone calls between the committee and eventually kept drafting, put it before the board, discussion, voting, and like I said, formalized just yesterday. So the focus area was increase the capital resources of TRIO, which include both the human and the financial aspects of it, to enrich the internal communication so that what we have to offer is understood by and available to all our members, to instill that one TRIO culture, and I think we're almost there, and finally goal 4, to ensure TRIO's strategic plan's effectiveness, which means how are we going to monitor this and make sure it doesn't become that file in the file cabinet or the book up on the shelf that somebody wakes up 10 years from now and says, oh, we had one of those. And so you'll see that as we step through. First goal, increase human capital. First, the human side. The objective was to grow the membership base, to reach out to recover inactive names as members. Currently, we're about 800 members, roughly. We have a database that dates back a good 10 years, which has 5,000 names, addresses, telephone numbers, and statistics on people, the organ type, things of that nature. Most of those are garbage at this point. People died, people have moved, people don't have that phone number anymore, etc. But what I've been insisting as president, that we don't throw that away. We've got to somehow go through that one more time with some volunteers and giving it back to the chapters to work those that were associated with their chapters. The problem is there's a lot of people in there associated with chapters that don't exist anymore. I don't know how many of those we could recover if they knew what TRIO was today and where they are in their lives today. But I think we should at least ask them and put something in front of them so they can make another decision. And then if there's no chance, we can't find them, they say no, fine. They come out of the database and we get down to whatever is a realistic database that we can communicate with. So grow the number of TRIO chapters. We're working on 2 chapters right now, Baltimore and Seattle, who have recently incorporated with the TRIO name. They have not gone through the chartering process yet, but it's kind of exciting. After years of steady, sometimes decline, we've got 2 new chapters coming on board sometime in the near future, and in turn, generally growing the number of new members, both through the resources we're giving chapters, Transplant Presentation Library being one example, or getting members at large who are not geographically close to a chapter, but to sign on. And then become our challenge is how do we get those services to them? How do we provide them with a support group when they don't live next to a local chapter? And so we have Will Oler and one of our board members, Lou Reardon, working together on that, trying to find some leadership and forming what we're calling a virtual chapter. Maybe using technology to provide the services that you get in a local chapter. I'm not going to go through all the detail in here. I just want you to know, like we talked this morning, if there's goals, the objectives under the goals, and written plans of how to do it, measurable, so that we come back and say, whoa, we're slipping on that, we're not doing it. Well, what do we have to change to make it real? Or are we on target, etc. That's all about using that database and volunteers to get to those people to see if we can recruit them again. Again, these will be available on the website so you can look at it in more detail, certainly. Growing the number of chapters. We have 13 chapters today, plus Japan chapter, our 14th, our international chapter. Potential of having 15 sometime soon. Wouldn't I love to find from that database a number of people in the geographic area where there was a chapter before, but it just drifted, and we find somebody who's willing to reach out to their friends and come back. Or they morphed into another organization for whatever reason. And maybe we can get them to see the value of a network under a national organization again. Just some ideas there.
Is Japan the only international?
There's one over in Italy someplace, and we don't have any communication with them. I can't even find them on the website, but I think they're still around. When you do Google search on Trio in Italy, you find that there's groups by the name of Trio, there are bands, stuff like that. So we don't have any contact. Yushi is our contact for many years over there. He's got a strong chapter that's still doing Trio under that mission. That's the only other one. There was some talk some time ago. There's a lot of transplant unity down in Australia, for example. And we were, JT's idea, since he went down to the World Games there, was to see if we could not build a relationship and eventually develop a chapter in Australia. It has not taken off, to be honest.
I was at the Transplant Games there too, in Australia. They did increase their donation though.
Oh, yeah, that's what it does when they come there.
Transplant Games.
But we have not been able to move forward to get them to get involved with Trio and become a Trio something, okay? The financial resources, the objective was to improve financial position and stability. And so we have some subjects there of increasing overall net income annually by 10% and controlling operating expenses, two obvious ways to do it. Bring in more money, don't spend as much if you don't have to. And so we have detail under that, and that's what we're going to be measuring against, just so you know. And so an event like this, our goal is to manage it within budget. So there's a budget that goes before the board for approval based on what we hope we can bring in as far as sponsorships. We give away to members as scholarships, food, any other expenses like the bags, something else I'll show you in just a minute. And so managing that within that, as opposed to coming back after it's over and said, well, we overspent by $10,000. Oh, well, it doesn't work anymore. Enriching the internal communications being the goal, the objective to support the other goals and objectives with effective internal communications to all our members. And to do that, we have our various communication vehicles that you're familiar with, lifelines, the email blast that go out to anybody that'll give us an email address. And there are chapters that say, none of our members want to see your e-blast, so we're not giving you email addresses. With 200 members, how can that be true? However, that's what we're told, and so we have pockets of people who are not taking advantage of what I think is a pretty cool messaging tool, wouldn't you? I mean, put links in there, it's timely, and then of course we have the website, and we have individual mailings out to our board, to general membership, to members at large, and chapter presidents. And of course, we have the website. We do surveys once in a while, like you just saw. Very powerful, very easy to do, and very useful information coming out of it. And so, getting more email addresses down there, number 5, is in support of this objective. Enrich the internal communication continued. Just some more ways that we see doing that. To that end, we have this concept of chapter champions. We wish each chapter would be able to identify people of interest for our key initiatives. For example, let's take the Transplant Presentation Library. It goes out every month with a new topic. We publicize it and everything, but I'm sure that in many chapters it's not publicized enough for people really to accept that. And so what we're hoping is that somebody could say, you know, I'm willing to, one, receive communications, always which will be copied in by the chapter president, so we're not working around the president at all. We're trying to give some other way for that individual member to get engaged in what TRIO is about. And they would get the message that, by the way, this month we're releasing a new topic. It's about hypnotherapy for transplants. That's the one that's coming up next week. Wouldn't it be cool to have somebody in your chapter know that and say, that's an interesting topic. And as part of your meeting agenda, the chapter champions get to say, hey, we got a new topic coming, sounds kind of interesting. Or, hey, I saw one of the other topics, why don't we have a meeting around sex discussion? It was very popular, we understand, and by the way, it was recorded, and we have something we could bring into our meeting and have discussions around. I mean, the chapter champion would be the focal point for each of those topics, and so we would have contact points, I believe there's like 4 areas that were identified so far. So if your chapter hasn't responded to that yet, and very little have, and the chapter president said, well, I'll be the contact. Okay, but we're trying to spread it out for you, help you get a way of getting more people engaged, and not having you get overburdened with all this work. So work with us as best you can. You know your group. Okay. Oh, I'm sorry. The one number 8 there. Something we haven't started yet, but we have a group which include past presidents of national, also who've been presidents of chapters, who are going to start building a stronger regular relationship with chapter presidents by having a call with them with an agenda of 1 or 2 topics to talk about that are critical at this time, and soliciting feedback from the chapter presidents that we can come together at the national level and see how we can help. So Elizabeth, myself, JT are the 3 I'm talking about right now, and we've got to document that process, put it in place, and it'll be a phone call every 6 weeks or something to your chapter president, and just have a conversation for a half hour on the phone. Simple. And still the one trio culture, we still have that challenge that we have chapters that when they go out for their membership to pay dues, there's 2 boxes to check. I'm a local chapter member, I'm paying my $10 dues, and there's another box that says I want to be a member of national, and I'm paying $10 for that. There's no such thing. You're either a trio member or you're not. The dues are whatever you as a chapter decide to charge. But for each member, you owe national for all the support you get there, $10. You want to charge $1, okay, send $10 to national. You want to charge $50 and get away with it, by all means, send $10 to national. Those names you submit with dues paying, and don't forget, money is never an issue. If you have somebody out there who wants to be a member and they can't afford that level of dues, and you want to make them a member, that's fine. When you send it in, notify Sylvia that this one is financial need, there's no dues to go along with it. Okay? But if you're saying you got 90 members and you're sending in 40, I'm telling you, Trio does not have 90 members. It's got 40. Well, we got these 50 others. I'm sorry, there's no such thing as local or national membership. You're either Trio or you're not. Suzanne?
I just had a question. I saw on the Philadelphia membership that you guys have a family membership for $40?
No. Some other chapters do, we don't.
We did.
Did I make that mistake on our brochure? The brochure was done about 2 years ago, and we're not going to change it, obviously, it costs too much to print. I can't remember what it says on there, but if it does, what's it say?
40.
40?
Well, I think it was if there's kids, if there's a
Oh, yeah.
husband, if
Yeah, I think
there's
that,
a
you know, it's
husband, wife,
assuming-
and children,
exactly.
you
Right.
wouldn't have to pay
So we
more
charge
than
them
20.
double
It's
the single
assuming
membership
it's
for
two
family
parents.
membership, which is the husband and wife, and if they register the kids, fine, but it's really the adults, okay?
Oh, okay. I just wondered,
Yeah,
can we do,
you caught me good.
okay, I had
Yep.
a question because we do family membership as 20.
Your choice of dues is up to the chapter.
Okay,
If you are doing that for a family membership, you're charging $20 dues, that's not a problem.
okay.
You send us 2 names, we're expecting $10 twice. You're putting
Okay.
$10 with each name you're submitting as a Trio member.
Okay.
If you do that through a family membership, that's your choice. You can charge them any amount you want for a family membership. But when it comes to actually registering them in the national database as a Trio member, it's costing you $10 as a chapter that you're passing through. Is that clear to everybody? It's part of the education process. Most chapters have come to understand that, and they're changing. If they have paperwork like that, they're fixing it. We still have some chapters that say, well, no, I've got 900 members. All right, let's add $900 and $10 a time member, or $9,000 would that be? No. $9,000. Guess what? No check coming for $9,000. They're talking about people that said, I like your Facebook site. You know, stuff of that nature. Well, they're not really Trio dues-paying members. So that's what one Trio is all about. And increasing membership engagement using Trio services, publicizing what we do for being a Trio member. And so the one Trio culture has a number of educational aspects to it to carry that out. Increasing membership engagement in using our services. We've got all these services. And so, for example, recently, we came to realize that transplant presentation library, which grew from the simple concept of one a month in a 3-ring binder. At the end of the first year, we extended for the second year, we had another binder, and by the time we got to the third year, we had 3 of these big binders, and realized, who's going to carry those to a meeting each month to encourage use of it? Nobody. Some people couldn't even find those 36 programs in the 3 binders anymore. Okay, we came up with that carrying case that will fit about 5 or 6 years worth in it. And we sent it out there and said to every chapter, how many of the programs can you find? Whatever you can't find, we'll replace. If you say you can't find it all, we're giving you all 36 programs again. And we did that. So we started over, going into the 4th year, with a carrying case that's only about this big, easy to carry, everything's in it. And so what we're hoping is that the chapter champion for Transplant Presentation Library will take it to the meeting and say, by the way, I got them all here. If you want to borrow one, you're welcome to. All right? And again, if you lose anything from that, we replace it. There's no charge for it. We want you to have that resource. It's an example of the type of services that we're trying to put out there. And we have done a survey to gather feedback on the services, and we'll probably do another one in 2013. All right. Ensuring the strategic plan is effective. To keep this as a living document, objective, make plan real and living for the long term. Basically, we've got a number of actions that keep it first between our managing service director Sylvia and myself every month to be talking about what our actions were, whether we're on target, whether we're falling behind, reporting to the board, strategic plan review, the strategic plan committee, reviewing that on a quarterly basis, and making a report to the board of progress or where we are on things or where we're slipping on something. And on an annual basis, do a formal review of that strategic plan. So it won't be 15 years later that we're saying, where's the strategic plan? Well, we did one. Where is it? 97. 15 years later, we got one. Not going to be 15 years between this and the next one. Right? It's going to be a living document. This is not entitled Strategic Plan 2012. It's TRIO's strategic plan. And so that's how we're going to try and keep it alive. That's our strategic plan. I'll take any general questions if you have them. Just know that this is coming out, so you have more time to read those and digest it in the time ahead. Anybody have a comment or something you want to say about that before I move to the next topic?
Can we stretch our legs before the next topic?
Oh, I would love to. My legs are killing me. All right.